Thanks for staying with us on Vision. Cedric Varner, glad to get a chance to talk with our health and wellness professional today on this segment of Visions. And our professional for today is Mr. Gilbert Darrington, who's the CEO of Health Services Incorporated. Mr. Darrington, thanks for being here with us on the program.
It's a pleasure. Thank you for having me.
Really, really good. You've got a big center over there, Mr. Darrington, and we just kept looking at it, and so we just wanted to get you to come over and tell us about a lot of the things that you got going in there.
Sure.
The comprehensive services, tell us just really kind of in a brief synopsis of what you all do over at Health Services.
Yes, Health Services Incorporated, we have 10 different centers, 10 different clinics where we provide care, and we have 2 wellness centers as well. But the care that we provide is everything from preventative care through to dentistry, optometry. We also offer behavioral health services. So any service that an individual could have other than overnight hospitalizations, we offer at Health Services.
Okay.
And we have board certified physicians, we have nurse practitioners providing care, and a lot of support staff as well. So just any health care that you can possibly think of that an individual would need, we provide at Health Services.
Okay, so for any health care that a person can need, I mean, who are the people who should come to your center?
We want everyone. We want everyone.
So who is this for?
we want everyone. And actually we provide, a lot of people ask, are you the free clinic? Well, we're not the free clinic. We provide service for, most of our patients are Medicaid, and then we have some uninsured patients, but we also take any type of insurance that a person would have. And again, we are trying to brand ourselves to the public to let them know that we provide services for everyone, regardless of their ability to pay.
Okay.
And we provide in quality care. So we want to provide care to an individual who has Blue Cross coverage, just the same as an individual who's uninsured. And we receive a federal subsidy to offset the cost of the uninsured patients, but that doesn't negate the quality of care that we provide. So what we're trying to do is let everyone know that we have this wide variety of services, but we offer them in a quality manner as well, and in quality locations. Like you mentioned, our River Region Clinic here in Montgomery, one of the state-of-the-art facilities in the region. But we also have 10 different centers all around the River Region where we provide great care to the patients that we see.
Well, I want to also make mention of your website. I was able to see a lot of the things that you offer through, and it's well done. And it shows on your website your various locations.
Yes, yes. And so our website is fairly new, just like you said. We have a new marketing director who came in, and she's doing a great job and got us up and going with the new website. And so it illustrates and it highlights the 3 different areas. We call it our physical, our social, and our behavioral areas. And if you go to the website and you pull up physical, for example, you'll see all the physical services that we can provide for an individual, such as the preventative care, such as the dentistry and optometry, the social things that we would help individuals. We have some people that come to us who would need to be referred out for other services. So under the social area, we offer referral services. So if someone needs a cardiologist and we need help referring out to a cardiologist, for example, we offer those services through Health Services as well.
Well, we've actually got your website on the screen, and speaking of your website, and I see your tagline and your brand statement is innovative quality healthcare.
Yes.
And so people can just log on to that, healthservicesinc.org.
Yes, healthservicesinc.org.
And they can access all the information.
All the information right there, and it's user friendly. And we also have built in a patient portal as well. So a patient can log in, create an account, and if they're a patient of ours, a couple of different things they can do. They can schedule appointments. They can look at their account if they have an account balance with us. They can make payments on the website. And so it's real comprehensive, real user friendly. All of our contact information is there. The services that we offer are there. So we're just trying to make sure that the public has access to us in many different ways as possible.
Well, you talked about your locations, and you've got several locations, and one of the other points we want to make now, and we're going to move to trying to get the slide, is you've got a health fair coming up in July.
Yes.
And it's called Wellness Works.
Yes.
And so this Wellness Works in the River Region.
Wellness Works in the River Region.
Tell us what's going to happen. We got that on our screen now.
Okay, yes. Well, Wellness Works in the River Region is our annual health fair that we do. You know, as a healthcare organization, we of course provide healthcare, and we want to do preventative care. But I think one of our biggest obstacles and our biggest challenges is to educate the public. So a lot of times when we can get people in for health fairs, just do slight screenings, but we also offer a lot of educational material. We offer classes and information about how one would take care of themselves, healthy lifestyles, healthy eating. We have dietitians that will come over. So a lot of different things will go on during that health fair. It will be held outside of the River Region Clinic. We'll have it inside and outside, different stations set up. And we want as many people from the region to come in as possible. First of all, just to take a look at our facility, but then also to receive valuable information about taking care of yourself and the services that we provide and the services that one would need at different stages of life. You know, there's different tests and those things you need at different ages. So we offer that education to the public as they come in.
Well, let me say about the health fair. I've been to that health fair, it's really good. And so we certainly encourage people to go to it. You got vendors inside the building, you got vendors outside the building. You get a chance to tour the building, see what a great facility. You got music. You're gonna have MCs out there. You got some food for us to eat.
So you've been there. you taking part.
I know all about it.
Okay, good.
Yeah. So we certainly want to encourage people to go to that. Now, wellness centers.
Yes.
You got 2 of those.
Yes, we have 2 wellness centers. We have one here in Montgomery and one in Haynesville.
Okay.
And the great thing about the wellness centers is that, you know, a lot of times, again, with health and taking care of oneself, it's more than just taking medication and seeing your physician. It's also about eating right and exercising. And so we were able to build 2 wellness centers to allow individuals to come in and work out. We're open from 6 until 8 at night. And we have personal trainers there. We offer classes, Zumba classes, and weight training classes. So we're helping individuals not only to learn about what they can do to take care of themselves, but also we're providing a venue for them to actually work out. And the membership is real reasonable. So if someone does not have a health center, or if you're a member of a health center, we still encourage you to come over to the River Region Health Clinic and Health Center and participate in some of our activities that we're doing there.
Now, where are the wellness centers?
The Wellness Center here in Montgomery is on Chestnut Street, right behind the River Region Clinic, brand new facility. And the one in Haynesville is located close to our clinic there in Haynesville.
Okay.
Yes.
All right. Real good.
Yeah.
Well, now, one of the other things that you were telling us that you are working on is a veterans program.
Yes.
It's called Veterans Choice?
Veterans Choice Program. We're really excited about that. A couple of weeks ago, we got in contact with the VA because we want to offer services to our veterans in the area, in all of our rural areas. So we actually signed up and were approved for a program called the Veterans Choice Program, which allows us to see veterans who, you know, you've heard a lot of stuff in the news lately about access to care for the veterans at the VA hospital. Well, we are able to provide care approved by the VA, so we will get a referral from the VA for a patient who needs an appointment. And we could see that patient just like it was our own HSI patient and work in coordination with the VA to get that patient seen. And what's really important to me about that program is that, of course, we have 10 different centers, 9 are out in outlying areas. So there are some veterans who are out there maybe in Haynesville or Clanton who can't make it to the VA. Well, if they get their approval and the referral to us, they could go to one of our local clinics there close to where they live, and they can be seen. So it's going to be a real good program for us. We just started it, and we're really excited about the opportunity to be able to care for our veterans.
Well, and we're going to pull that screen up. There's an 866 number on there.
Yes.
866-606-8198. You know, so you press 1, and that puts you directly through the program.
That's right.
Okay.
That's
now
right.
I happen to know you're a veteran, and you know you may not know that I'm a veteran, but now if I don't want to go to the VA, you saying I can come?
Yes. Well, what you would do is actually call. You would actually call the 1-800 number. And get a referral. And let them know that you want to be a member of want to be seen at Health Services Incorporated.
Well, I'm going to tell them I talked to Mr. Darrington.
And we're going to provide excellent care. We'll let them know you talked to me.
Okay.
We're going to provide excellent care.
We're going to let them know we talked to the CEO. That's what we're going to do. Now, this you got a HPPV grant.
HPV.
Okay. All right.
Yes, we were in the news last week before last. The weeks kind of run together now. They come so far fast. But we received the grant through the CDC and American Cancer Society to provide HPV vaccines to children. And HPV is really targeted towards 11 and 12-year-olds. And HPV is so important for the vaccination because this is a disease or virus that's contracted through some type of contact, some type of sexual experimentation or something like that with someone who's infected with the HPV virus. And the virus can lead to several other cancer issues later on in life, anal cancer, colorectal cancers, those type things, cervical cancer, and just by simply being vaccinated could prevent that or go a long ways to preventing those disease processes that would happen later on in life. And I told everyone the main thing with that age group, the 11 and 12-year-old, we have to get the parental consent to administer those vaccines. So it's very important that we go into the school systems and educate the students, but also we need to educate the parents as well. So things like the health fair would allow us an opportunity to bring the family members and the parents in to educate them. We have informational screens in our centers that talks about the HPV and what we're doing to help reduce those risks of cancers later on in life. So that is just a exciting program as well, to be able to provide care or provide a service for those children that would prevent them from later on having those catastrophic illnesses and diseases. So,
all right.
Yeah.
Well, fantastic information. Now, so for people who got things that they need to look at, are you saying that they come to your center versus going to the hospital? How do you want them to manage their care through your center?
Well, we provide primary care. Now we're great partners with both of the hospitals here, the systems here in Montgomery, and all of the other facilities here. But we are providing primary care, and the key to the entire health system in controlling the cost is someone taking care of themselves before there's hospitalization. Now, that's not going to put hospitals out of business, but in order for a person to have a better quality of life at the end of their life, they have to take care of themselves along their entire life.
Yeah, before.
Right? Before they're hospitalized.
The need, really, right?
Exactly, and that's
Excellent.
what we do.
Excellent.
That's what we do.
Well, Ms. Darrington, we really appreciate you coming on. Really great information.
Thank you.
Look forward to. I'm going to come to your health fair.
Well, come on.
We got time, but I'm going to come to it.
Look forward to seeing you.
And that's going to do it for us on this edition of Visions. Excited to talk to Mr. Gilbert Darrington, CEO of Health Services Incorporated. Thanks for watching, and we'll see you next time.